The primary survey in trauma is a systematic and organized approach used to assess and address life-threatening injuries in trauma patients. It is based on the ABCEE mnemonic, which ensures critical priorities are identified and managed in a stepwise manner. Here's a detailed explanation of each step. A. Airway with cervical spine control. Goals: ensure the airway is open and maintainable. Protect the cervical spine in case of suspected spinal injury. Steps: 1. Assess the airway. Look for signs of obstruction, such as stridor, gurgling, or silence. Check if the patient can speak or vocalize normally. Inspect for foreign bodies, facial injuries, or swelling. 2. Clear and secure the airway. Perform a jaw thrust or chin lift to open the airway while maintaining cervical spine alignment. Remove foreign objects or secretions using suction if needed. Insert airway adjuncts, e.g., nasopharyngeal or oropharyngeal airway, for temporary support. 3. Cervical spine stabilization. Assume cervical spine injury in trauma patients until ruled out. Apply a cervical collar and manually stabilize the neck. 4. Definitive airway management. If the airway is compromised or at risk, perform endotracheal intubation or a surgical airway, cricothyroidotomy. B. Breathing and ventilation. Goals: ensure adequate oxygenation and ventilation. Identify and manage life-threatening conditions affecting breathing. Steps: 1. Assess breathing. Inspect for chest rise, effort, and symmetry. Listen for breath sounds on both sides. Palpate for chest wall integrity, e.g., flail chest, tenderness. 2. Intervene for breathing problems. Provide oxygen via mask or bag valve mask. Address tension pneumothorax with needle decompression and chest tube placement. Manage open pneumothorax by applying an occlusive dressing. 3. Monitor oxygenation. Use pulse oximetry or arterial blood gas, ABG, to assess oxygen levels. C. Circulation with hemorrhage control. Goals: ensure adequate perfusion and control life-threatening bleeding. Steps: 1. Assess circulation. Check for pulses, carotid, femoral, radial. Assess skin color, temperature, and capillary refill. Measure blood pressure and heart rate. 2. Control external bleeding. Apply direct pressure, tourniquets, or hemostatic dressings to bleeding sites. 3. Manage shock. Establish 2 large-bore IV lines or intraosseous access. Begin fluid resuscitation with isotonic crystalloids, e.g., normal saline or Ringer's lactate. Administer blood products for ongoing hemorrhage. 4. Identify and treat internal bleeding. Perform a focused assessment with sonography for trauma, fast, or diagnostic imaging. D. Disability, neurological assessment. Goals: assess and monitor neurological status. Identify life-threatening brain or spinal injuries. Steps: 1. Evaluate level of consciousness. Use the AU scale. A. Alert. V. Responds to voice. P. Responds to pain. U. Unresponsive. Alternatively, assess using the Glasgow Coma Scale, GCS. 2. Check pupil response. Assess size, equality, and reactivity of pupils to light. 3. Identify and manage neurological threats. Consider emergent imaging, e.g., CT scan, for suspected brain injury. E. Exposure and environmental control. Goals: fully expose the patient to assess for injuries while preventing hypothermia. Steps: 1. Expose the patient. Remove all clothing to inspect for injuries, burns, or hidden bleeding. Log roll the patient to examine the back while maintaining spinal alignment. 2. Prevent hypothermia. Cover the patient with warm blankets. Use warming devices, e.g., heated fluids or forced air warming. Additional considerations: reassessment. Continuously reassess the ABCDEs after interventions. Adjuncts: use imaging, laboratory tests, and monitoring tools as needed to guide further management. Prioritization. Always address life-threatening conditions before moving to the secondary survey. This structured approach ensures rapid identification and treatment of critical injuries, significantly improving patient outcomes in trauma care.